I have patients that deal with all types of physical traumas and emotional traumas, primarily physical traumas right after a critical injury would transpire. I provide psychotherapy bedside and I support
Mm-hmm.
the families. I also help with end of life care and so forth and so on. And usually, when the patients come in after suffering a critical injury, we discover that there are some additional traumas underneath that, either have had some work done around it or absolutely no work, no intervention, and it surfaces and then it turns into PTSD. And so the goal is for us to make sure that the acute stress is not turning into PTSD over time.
Gotcha, gotcha. So, how did you come into the field of trauma? Because at least for me, when I was in school, it wasn't a specialty. So I went to school for clinical psychology, and then after I graduated, I actually started studying and specializing in trauma in my own time, taking extra coursework and taking certifications and trainings and things of that nature. And I'm not. I know we have a age difference, so I don't know if your education was different, but I didn't actually train in my doctorate program. Like we got a very small portion of education on trauma, and it wasn't even a full year or a full class. It was like I think it was like 35 minutes on trauma. But at that time, there wasn't a lot of research materials and resources about trauma when I went to school. So how did you get into the field? What drew you to the
So,
field?
so Westchester, it pretty much wanted us to be very well rounded. So we were going through curriculum that was basically conditioning us to be able to go out and to treat patients with dual diagnosis. The curriculum just really tailored itself towards trauma in my clinical hours. And so
Gotcha.
what they would do was start to basically narrow down where you were going to be by your last 2 years of school. And so for me,
Hmm.
I indirectly can continue to find myself in dual diagnosis, drug and alcohol, or child therapy. And I just
Gotcha.
rebelled it. And, you know, God will put you where God wants you. And so the rebellion was met with, you're going to go exactly where I want you to go.
Where I
And
want you to go.
there you'll flourish, but if you go against the grain, obviously things become challenging. And when you situate yourself into where you are supposed to be, then everything starts to fall into place for you. So for me,
Hmm.
my clinicals were primarily spent in institutions where there were dual diagnosis. And then my classes were already in alignment with it. So all of the additional training just fell into place around it. And then when I found myself in facilities, obviously that started leading to additional credentialing around trauma, around things such as addiction, and what leads to it. Obviously, there's going to be some traumas experienced by the person that is struggling with substances and chemical dependency, or they already came with trauma prior to substance use and chemical dependency. So all of it just aligned itself naturally through my program.